Back now on Triad Today, and folks tell me, when they email me sometimes, see me on the street, that they like to find out things about our guests. So we're going to do that with a noted surgeon in our area. And Dr. Carl Buchholz is a general surgeon with Northern General Surgery in Mount Airy and part of the Northern Regional Hospital family. And we're so glad you come down and visit with us.
Thank you very much for having me.
So let's probe into your background. Tell us, where you were born, where you grew up, where you went to school.
Absolutely. I was born in Waukesha, Wisconsin, but I spent the first 10 years of my life in Seattle, lived another decade in Phoenix, Arizona, and then I came out to the East Coast to start medical school in Charlottesville.
Right. So you moved around a lot.
Yeah.
And you went to both UVA and Arizona. Did I get that right?
That's right. Undergraduate Arizona, med school UVA.
Well, I have a nephew who's one of the baseball coaches at Arizona.
Oh, yeah.
And so I'm compelled to ask you, if UVA and Arizona play each other in baseball or something, what are you going to do?
Oh, I mean, bear down all the way. Arizona.
Okay. All right. Now, I'll be sure to send a copy of the show to the folks at UVA. Who or what led you to a career in medicine? Was it a person or teacher or what?
My mom's an oncology nurse, still is actually in Phoenix. And so she was a big influence on me when I was growing up. She was one of the ones who encouraged me to go into medicine. And I always thought I was going to be a trauma surgeon. I figured I'd be in a major metropolitan area, all the way up until my general surgery training and residency. And then it was coming out to some of the smaller hospitals and falling in love with those people and places that I knew general surgery in a rural setting is what I was going to want to do for the rest of my life.
Absolutely, because you guys draw from Northern Regional Hospital and the surrounding practices like yours. You guys draw from all over the area, including up in Virginia.
We do.
You got people coming down from Virginia and that too. Now, as you said, you've been all over the country. Mm-hmm. You've gone to school in different parts of the country. I guess what I'd like to ask you is, what attracted you to the Mount Airy area to Northern Regional?
Yeah. Well, like I said, I wanted to do rural general surgery. And here I was excited to have the opportunity to join a really strong established surgical practice. And I have the privilege of having two experienced partners, Dr. Corbin and Dr. Bond, who already have been working and practicing in the region, know it well, and who I can lean on and trust as a couple of mentors as I'm getting started in my career.
Yeah. Well, how would you describe your approach to patient care?
I think the most important thing, the cornerstone of good patient care is listening first. People's bodies don't usually read the textbook, and their problems don't fit into a neat little box, but the more you listen to them, the more you hear what they have to say, the better your chances of coming up with the solution that's going to be the best fit for them, that's going to help them the most.
What types of surgery do you perform?
The joke about general surgery is we operate on the skin and its contents.
Yeah.
But if I
thought it was meant if you just operate on generals. I thought it was a military thing or something.
Gallbladders, colon surgery, a lot of cancers, breast cancer, colon cancer, small bowel cancer.
Right.
Problems that you have after abdominal surgery, small bowel blockages, and everything in between. Ports, vascular access, pilonidal disease. There's a lot of stuff that we take care of.
Again, what's good about your approach, the way you were describing it is, we're going to sit down with me, and you're not immediately going to say, well, we're going to rush into surgery right now. I mean, you've got some give and take there, and,
That's right.
and really communicating is important. You're almost like a counselor too, right?
That's true. Yeah. It's as important to know when not to operate as it is to know when to operate.
Right. Now, in the few hours that I'm sure you have to relax, because I know you're busy, what do you like to do for fun?
I guess you could say I'm an old soul with a modern twist. So I moved here with my wife Sarah 5 years and our daughter Leora just turned 1. And we like to garden, can, split heat with wood, hunting, press and cider, all that stuff. But if I find the time, I like to dabble in some tech, a little bit of programming, build computers, all that stuff in my free time.
So you're crossing over from the old world into the tech world.
That's right, just a dabble of each.
Well, that's great. Now, I know we're going to get you back next month, and we're going to talk about a specific type of condition that you help people with, and we'll do that. But for now, I'm just glad you had a chance to come in and I could learn some stuff about you. I appreciate what you're doing.
Well, thank you very much.
Up on screen, you can call 336-789-9176. That goes directly to Northern General Surgery, or you can go to the general website for the hospital, choosenorthern.org. All right, we'll be right back after this.